Welcome to this evening's information session with Do No Harm, speaking on the transgender issue that faces America's children today. The mission of the AMAC Foundation is to help protect and ensure the financial security, health, safety, and social lives of current and future mature Americans, and to help Americans navigate the bewildering array of decisions they need to make. Keeping with our mission, we have a great team here this evening to deliver information on the topic we receive questions and concerns about. Before we get started, though, there's something I want to share with our group this evening. This comes from a grandmother who has firsthand experience with the transgender topic. The testimony submitted reads, "Thank you for getting the word out about hidden agendas, the transgender culture. I visit my mid-teen grandchild at the cemetery and wish that no one ever has to experience the heartbreaking loss of a loved one exposed to alternative gender choices that they are not mature enough to make. Our grandchild was a wonderful young person with the best parents. If it can happen to our family, it could happen to anyone." And I just want to thank that person. She did wish to remain anonymous, but she's grateful that everyone can join and share information and also ask their questions. So again, we welcome your in the Q&A. We will try to get to them. And Brittany, I'll hand it over to you.
Thank you so much, Jolene. And that's such a powerful testimony and exactly what this event is about. So we want to welcome every AMAC member and friend who's here with us today, and also our amazing panelists. And so I'd like to begin by briefly introducing them, and then we'll ask them some questions, but we'll make sure to save some time at the end to be able to answer as many questions from all of you as possible. And so with that, let me start by introducing our panelists. Right now, we have on here today Dr. Travis Morell, who is a husband, father, and physician leader. He is a lifelong learner and has medical training in 5 specialties. He is a board-certified dermatologist and dermapathologist in private practice in Western Colorado. And he seeks to promote nonpartisan physician values such as free speech and evidence-based medicine. Also with us today on this panel is Michelle Harvilla, the Director of Programs at Do No Harm, where she is working to expose the health systems throughout the United States and their complicity in propagating unscientific and non-evidence-based gender-affirming care to pediatric patients. Michelle is an oncology certified nurse practitioner and has experience in healthcare technology. And we also have with us January Littlejohn, who I've had the honor of getting to know at several of our AMAC events over this past year. January is a wife and stay-at-home mom to 3 children. She's a licensed mental health counselor, and she has experienced firsthand the danger of the radical transgender ideology that is infecting our schools and our culture, as her daughter's public middle school tried to transition her daughter without her consent. And she and her husband have filed a federal lawsuit against the school district. And January now helps parents whose children have been subjugated to these terrible practices. And so we're really looking forward to hearing from each of you, and thank you all for being here today. And I thought we could start by, we just heard, of course, about kind of your background and your impressive biographies, but I thought we could start on a little bit more of a personal note about how you got involved with Do No Harm specifically. And I thought we could start with you, Michelle. You're a nurse practitioner, and I wanted to hear from you how you first became alarmed by this so-called gender-affirming care for minors, and also to ask you if you could give our listeners a little bit of an overview of Do No Harm and what it does.
Well, thank you so much for having me today. So I really began to see the influx of this ideology and identity politics into medicine in 2020 when I was still in practice in oncology, and we were really at the height of COVID, and there was a great deal of unrest throughout the country. And I became more aware of gender ideology as I started paying attention to what was happening in major medical institutions. I'm in the Maryland area, so Hopkins, University of Maryland, and particularly those institutions that were claiming puberty blockers are supposedly irreversible, or supposedly, I'm sorry, reversible, and without side effects. And my oncology training told me otherwise. Before joining Do No Harm, I worked primarily with breast and prostate cancer patients where Lupron and other forms of hormone or endocrine therapy are used legitimately to treat these diseases. And most, if not all, of the patients that I worked with and that I saw personally had some type of side effect related to either Lupron use or hormone therapy or endocrine therapy use. And so if these were adults who were experiencing these very significant side effects, I could only imagine what children were experiencing, and the long-term effects that no one was talking about. And so that's what brought me to Do No Harm, first as a nurse member, and then I came on full-time as an employee as director of programs, specifically looking at gender ideology. So at Do No Harm, we're an amazing group of people, and we represent clinicians, including physicians, nurses, medical students, patients, concerned citizens, and policymakers focused on keeping identity politics out of medicine, out of medical education, out of research, and out of clinical practice. And we believe in making healthcare better for all and not allowing it to be undermined by a political agenda, which is what I was seeing back in 2020 when I was still in the height of practice. Do No Harm, we really seek to highlight and counteract divisive trends in medicine, whether it would be diversity, equity, and inclusion, and youth-focused gender ideology. And nowhere is the importance of the oath, do no harm, more relevant than in protecting children from so-called gender-affirming care. This ideology is unscientific and is harmful, and hopefully this evening will really shed light on what we're seeing throughout the country.
Thank you so much, Michelle. That's powerful. And it's kind of incredible to think that, drugs that are used to cure cancer are affecting these teenagers unnecessarily. So I appreciate that overview. And Dr. Morell, you are a physician. And first of all, I could barely say one of the types of physicians that you are. You're a dermatologist and a dermapathologist. Could you tell us what that means to begin?
Thank you, Brittany. My name is Dr. Morell. I'm a dermatopathologist. So I'm an expert in skin cancer and melanoma. So I do clinic, surgery, and I run a lab for that. But before that, after I became a doctor, my first 4 years were in gynecology and primary care. So like Michelle, I had prescribed Lupron for cancer and also seen adult patients go through instant menopause or basically a male menopause where they're crying every day with this medicine. And I had actually taken care of adults and provided so-called gender-affirming care to adults. And I saw basically women instantly go through suffering with their genitalia when you prescribe them testosterone, which they're not supposed to have. But still, these were adults, so I knew these side effects. But then when it started to go to kids and I heard that it was going to kids, I knew that there was no scientific rationale. I spent a long time reviewing the evidence and there was definitely no clinical rationale. And I realized this had gone through, this was going to be way worse on kids than it is in adults. And also I knew this hadn't come from evidence or discussion. So I felt obliged that I had to speak up. And I'm very thankful for Do No Harm, which has given a lot of doctors and nurse practitioners, other clinicians, a way to speak up. And I'm thankful that they're probably the most effective in this space. I think Michelle will talk about the Stop the Harm database later. They're trying to make change and let people know what's really going on. So that was kind of my path.
That's really helpful. Thank you so much, Dr. Morell. And I'm looking forward to learning more from you. We're grateful that you're on this call. January, I've really enjoyed getting to know you, and I know our members have enjoyed hearing from you at several of our boot camps for boomers through AMAC this year. And every time you speak, the whole room goes totally silent because it's such a powerful personal story. And I'm wondering if for those members who are joining here today and having the chance to meet you for the first time, if you could just share a little bit about your personal story and your family's journey as we begin.
Sure. Thank you so much for having me, Brittany. And I just want to say first to that grandmother that shared her painful story of what happened to her family. I'm so sorry for your loss. And unfortunately, this ideology is having devastating impacts on families all over our country. And so I just want to preface this talk by saying that all of us at Do No Harm, and I know you are the same, Brittany, at AMAC, we're coming at this issue from a place of deep compassion and empathy for those who are struggling over distress with their sex. And so for us as a family, this issue came into our lives at the height of COVID in 2020. Our 13-year-old daughter came to us and told us out of the blue that she no longer felt like she was a girl. And this announcement came shortly after schools had been shut down. And 3 of her friends at the local middle school had 6 months prior also started suddenly identifying as some form of transgender. And I say that because often when we think of the word transgender, we think historically of someone who is identifying as transgender, or transsexual was the older term that used to be used. And it mostly impacted males. It was very rare. And when it did occur, it happened very early in childhood. And that was not correlating with what I was seeing in my daughter's friend group or with my daughter. So my husband and I took this very seriously. We were very concerned about her mental health because at the same time, like many adolescents during COVID, she was already struggling with the lockdowns and the inconsistency and the lack of structure. And it was a very scary time for a lot of kids, not knowing what was really happening in the outside world and when school was going to go back into effect. So we elicited the help of a counselor to help her with the co-occurring issues. But we felt like this was escalating with her very quickly. And as school started that fall, I had reached out to a teacher. I let her know that we had elicited the help of a counselor. We were not affirming the new identity at home, that this had escalated very quickly. And that I also felt like my daughter's confusion was a direct result of her friend group. Well, it turned out that teacher was the LGBTQ advocate on the middle school campus. At the time, I was unaware that there even was such a thing. And so when school started, I didn't hear anything back for a couple of weeks. And my daughter got into the car several weeks into the school and said, "Mom, I had a meeting about the name I wanted to go by, but they asked me which restroom I wanted to use." And so I was immediately shocked. I didn't understand, number one, why they were having a meeting, because I falsely and naively assumed that if she brought this new name that she wanted to go by, that it was going to be treated as a nickname. And that just wasn't the case. And so our communication with the school went back and forth for multiple weeks because our stories, as you know, Brittany, it's a long story. And so what we learned when we finally got a meeting with the middle school, because initially the school would not even tell me about the meeting they had. They told me my daughter was protected by a non-discrimination law. But when we sat down and was finally shown the social transition plan that they created with our 13-year-old daughter without our knowledge or consent, this went well beyond names and pronouns. They asked her which restroom and locker room she preferred to use and which sex she preferred to room with on overnight field trips. And these types of plans are very common. Anybody can look them up. They're from an organization called Gender Spectrum. And so the same variation of this plan was being used all over our country. And we quickly learned that what happened to our family was not an isolated event. And it really nearly almost destroyed our family. What they did was create a huge wedge between us and our daughter. And at that time, it felt like we were in some kind of twilight zone because it propelled our daughter onto this medical pathway where she was asking for surgeries that I had never heard of, like top surgery, which is a euphemism for a double mastectomy. And as a parent, that was very frightening that our 13-year-old daughter, out of nowhere, thought that her self-loathing, her emotional pain could be fixed by surgically removing her breast. And that's where we're at right now with this ideology. It creates confusion where no previous confusion existed. And it places these girls, most of them are girls, but we are seeing boys, it places these vulnerable children on a medical pathway that they cannot fully understand.
It's really heartbreaking. And January, thank you so much for your courage to share your story and help so many people who are in similar situations, to know that they're not alone, and to also know that there are other people out there who can help them through this journey and who can support them and their families. So we're so grateful for you and what you're doing, and for your powerful testimony. And I want to come back to you in a few moments too, so that you can give our audience more information about what they can do if they find themselves in a similar situation. But I first wanted to ask Michelle a question. Michelle, you recently released a big project that you and your team have been working on for months called Stop the Harm Database. This is the first project like this in the country. And could you tell our listeners a little bit about this project, and tell us a little bit about what was the impetus for creating this database in the first place?
Absolutely. So the Stop the Harm database is a publicly available online resource, and I will show everyone in just a few moments. It's an online resource of sex change treatments, including surgeries, hormones, and puberty blockers performed on minors at US-based facilities between the years of 2019 and 2023. And the impetus for this project was to expose the depth of these practices throughout the country. With this database, we're able to show that these procedures are being done on children and how lucrative they are. And I will say that what you see on the database is a very conservative estimate or display of what we're really seeing. It's only the floor of what we believe is happening throughout the country. And I'll explain a little bit more in just a moment. So to do this, to present this database, what we did is we analyzed publicly available insurance claims to assess which sex change related treatments each hospital had performed or administered. The claims were sourced from clearinghouses, data aggregators, payers, health systems, Center for Medicare and Medicaid, and multiple open data sources, and included claims from commercial insurances, Medicaid, Medicare, and publicly available VA claims. Part of the reason why we say this is just the floor is that we were not able to include patients that were covered by the Kaiser health plans, as Kaiser does not report its claims publicly, as well as self-pay cases and charity cases. So for example, in California, Kaiser is probably one of the largest commercial payers. And so we believe we're probably missing a large amount of children who are covered under this health plan. And this analysis focused exclusively on patients ages 0 to 17 and a half, and included only confirmed cases of sex change treatments, eliminating any ambiguity or gray area. And we confirmed this by matching confirmed sex change procedures codes, or what we would call a CPT code, or an NDC or national drug code or prescription code, with a gender-related diagnosis, or what we would call an ICD-10 code. So I'm going to go ahead and share my screen with all of you so that you can see the database itself, and I'll walk you through what we actually found. Okay, so is everyone able to see this okay? Okay. All right, so this is if you would go to the main page, and I'll walk you over there in just a moment, but this is what we found. So in the United States, between 2019 and 2023, you can see that almost 14,000 minors underwent some type of sex change treatment, whether this was a body modification surgery, whether they received hormone therapy or puberty blockers. Over 57 minors have had some type of sex change surgery or body modification surgery. So as January had mentioned, top surgery where they perform a mastectomy, bottom surgery where they will remove do what we call an orchiectomy or a penectomy, remove somebody's penis to create a pseudo vagina. And I apologize for being graphic, but I just kind of want to understand the depth of what we're seeing with these children. And we also saw about 8,500 minors who had received hormones and puberty blockers. Over 62,000 prescriptions were written for minors for this type of care. And what we saw in total, and again, this is just a floor, is about $120 million in submitted charges for sex change treatments on children under the age of 17 and a half between the ages of between 2019 and 2023. You can find this database at stoptheharmdatabase.com, and I'll just quickly walk you through. You can see here, you can look at any state in the nation that you can see what is being done. And I will tell you, there is no state that is excluded. There are several that have passed legislation, but all state in some form or other have performed some type of treatment on a child. And we also profile some of the most prolific children's hospitals in the country and what they are doing, what they are practicing on children, what they are pushing out into the community. We really wanted to highlight what is happening at some of the most what we would say trusted institutions in the country, where all of us at one time would feel very comfortable sending our children to.
Thank you, Michelle. I think that's going to be a really helpful resource, and obviously so much work has gone into that. So thank you for your careful work and stewardship of that project. And I know that will be a great resource to our members and to Americans across the country. Dr. Morell, I'm really curious to hear from you as a physician. What is your reaction to the findings? And could you share with the audience some of the risks specifically for pediatric patients with these procedures?
Thank you, Brittany. Yes, I mean, it's shocking to see $120 million over a few years spent on kids. And to be clear, and Michelle can correct me, it's only up to 17 and a half. I think they're being very careful. This is not 18 and 19-year-olds. This is 12 and 15 and 10 and 13 and 17-year-olds. So yeah, that's shocking. I think one of the things I was kind of aware of this. But it's hard proof. This is from insurance data. You can't argue this. This is a floor of what's happening. And I think one thing that's shocking too, that did shock me, was you can look up and you might see that your little country hospital or the little hospital in your small town is doing this. And you're like, what is going on? I mean, this isn't just the expert gender clinics or whatever. And so you might be surprised this is happening in your local town. That was surprising to me. The risk, you have to think about the risk to peds or kids is a lot higher than for adults. For an adult, maybe the cross-sex hormone or may change some things. They may go through some symptoms, and then if they stop, they may get some recovery of their previous state. But in a kid, when you're in that kind of puberty starts from 8 to 13, that goes on until they're older, there's a lot of things going on that from watching your kids or grandkids or other people's kids that you don't get a second chance at. We're not just talking about sex, which I think is important for people's relationships. We're not just talking about the ability to reproduce, which I think is important. And kids can't conceive of what they're giving away when they're not 20, 30, 40. They're, 10 or 12 or something. In my state, they do double mastectomy of 15-year-old girls. You don't really know if you're going to want to nurse or not nurse your baby, not to mention all the immune and warming and hormonal bonding that goes along with that. You don't really know when you're 15 if you're going to want to do that later or not. And if you think about bone health or osteoporosis or weak or breakable bones when you're 50 or 60, you only get one chance at building that bone mass, and it's really when you're younger. And puberty blockers is going to does stop that. Really concerning to me is that we know that there are reports of people's brain development being stopped. And by cognitive effects, I mean IQ and I mean memory. And what's really scary is just this year, a big review came out that said there's no evidence, multiple studies. I think it was a dozen or over a dozen studies. It doesn't show any proof that comes back. So when they say it's a puberty pause, some people call puberty blockers a pause. Yeah, it pauses it, but then there's no second chance. That's when you get the hormones are boosting your ability to think and remember. So those are all things. Lastly, even the doctors in charge of pushing this on kids, like the president of WPATH, which is the organization pushing this, they'll tell you that if you follow kind of the protocol and you put a boy on puberty blockers when they're 8, 10, 12, 13, and then you put them on hormones after that, when they're a kid, when they're an adult, they're going to have genitalia that's an inch long and doesn't work. So not only they're not going to even if they end up being, if they still, when they're an adult, they want to be trans and have a trans surgery, there's less tissue for them to use the more successful surgeries. And if they don't grow up and they still want to be trans, they want to be gay or straight, which in the studies we've known for decades, 98% of boys, if you leave them alone, they want to be gay or straight. Those kids, they're going to have less to work with, and they're not going to be able to enjoy intimate relationships. And I feel bad for these people's relationships, whatever they end up doing in life. And that's kind of where we can see that medicine's gone wrong here.
That's really helpful and in very scary context. So thank you for that. One follow-up question for you, Dr. Morell. We have heard some of these stories of different people like Chloe Cole who have kind of bravely come out and publicly detransitioned, but they can't, and they've talked about the fact that they cannot fully physically detransition and how that is affecting them as young adults. What has the medical response been to these particular cases that seem pretty compelling cases of kind of alarm bells to, everyday Americans like me?
Thank you for asking. Chloe Cole is one of our brave senior fellows that do no harm, and her and many detransitioners are coming out. I think it's brave of them. Some people have called them the canary in the coal mine over this. I appreciate that. If I was them, I just want nothing to do with this ever again, probably. And the fact that they're putting up with hatred and sharing that story, I really encourage anybody to just YouTube Chloe Cole or one of these other detransitioners and hear their experience. They can say things that other people can't say, and they have a real experience there, and I appreciate them sharing it. To answer your question directly, though, to be honest with you, like most of us, if we do something that hurts somebody, whether we mean to or not, a lot of times our first response is to just not admit it. And unfortunately, doctors are either really all into this or really not. But the people in the middle, that she is persuading those people. So I appreciate the work that she's doing.
Thank you very much. January, to talk a little bit about some of the influences that are kind of less medical, that lead up to the decision that a child might make to make a medical decision, as much as they can be responsible for such a decision at such a young age. Can you tell us a little bit about some of the cultural impacts that you think are affecting teens like your daughter, whether it be in the schools or in social media, or even in the other types of movies and TV shows that are coming out?
Yeah, absolutely. And since you brought up Chloe, I want to piggyback on what Dr. Morell said, because one thing that is the most tragic aspects of this entire medical scandal is there's no protocol for detransitioning. So not only have these individuals been medically harmed and experimented on, through unregulated experiments, especially when it comes to puberty blockers and cross-sex hormones on children, but now when they go to get help with trying to come off these drugs, there are no guidelines. So once again, we are exposing them to experimentation to even get them to come off of these dangerous drugs that are unproven, that they didn't necessarily need in the first place. But to answer your question, there are a lot of cultural influences. And unfortunately, what I learned when I did a deep dive into this issue in 2020, there is not one aspect of our culture that has not been infiltrated by gender ideology. And one of the things that I learned quickly, and I started to talk about this in my opening statement, was that kids nowadays are being taught and indoctrinated into a false belief system. And they're being taught that they have something called a gender identity. And this gender identity is completely separate from their sex, and that they choose to be a boy, girl, neither, or both. Then on top of this, there's about 72 of these so-called gender identities. Oftentimes they have their own colors, their own pride flags, and these are being marketed directly to children, not just in the schools, but it is heavily in the schools. Oftentimes you'll see it in the GSA clubs, which used to be the Gay Straight Alliance. These have often morphed into Gender Sexuality Alliance clubs. It's in the sex ed curriculum. It's in social emotional learning programs. And then you often see this during Pride Month. There's certain states that have these type of gender identity ideologies embedded into every subject. And then outside of the schools, we are seeing these in, of course, TikTok, on YouTube. There are trans influencers that are grooming children into believing that they were, quote unquote, born into the wrong body. And for my daughter at the age of 13, we thought we were being responsible parents. She was not allowed to have social media, but her friends had unrestricted access. And so unbeknownst to us, she was still being fed the same transgender ideology propaganda through those same mechanisms. It didn't matter that we had those apps blocked because she still had access to the same propaganda through her cell phones. And so Walt Heyer, back in 2018, he was one of the most original detransitioners, a very brave man. And he said back in 2018, we are creating and manufacturing these children. These children, this is not happening organically. And instead of being given a positive message of puberty's hard, everybody has a hard time, it's going to be okay. This was not a choice when Dr. Morrell and Michelle, and probably even you, Brittany, were growing up. This was something that I did not see clinically at all. Most clinicians would have gone their entire career and never had a client who was experiencing any kind of gender distress, gender dysphoria. So the fact that now the UK has seen a 4,000% increase in teen girls identifying as transgender, that's astronomical. And the lack of professional curiosity, coupled with organizations like the American Academy of Pediatrics, silencing debate, silencing doctors like Dr. Morrell, who raised concerns over, is this evidence-based treatment? And we now know definitively it is not. And so a lot of these cases are now going to be looked at. We even have Scrimetti at the Supreme Court. Alabama submitted a scathing amicus brief on what the WPATH information, the WPATH files that Michael Schellenberger exposed have showed. And they even, Brittany, removed all age restrictions from these so-called standards of care. So this is the Wild West of gender medicine. There are no safeguards for these kids, and it's all based on self-ID. When you talk to any of the so-called gender experts, they all say we follow the child's lead. Where else in the field of medicine do we allow a child to lead them into irreversible medical interventions? And so we are just in a time where there's a perfect storm, where schools are secretly transitioning, socially transitioning children like they did to my daughter. And that is not a benign intervention. That is the first step toward medical intervention. So we have schools keeping secrets. Let's be clear, this is a mental health issue. So they are choosing to keep a mental health issue from parents, like they did with my daughter. And this is causing so much distress in families. I speak to families every single week that are being torn apart by this ideology. And most of these girls have co-occurring mental health issues. Many of them are on the autism spectrum. So girls like my daughter, she didn't want to become a boy, but she was trying to escape girlhood. And that is something that we don't talk about enough. This is so rampant in our culture, and parents need to take very serious steps to protect and inoculate their children from this ideology, because it's not if, it's when they are exposed.
Thank you, January. That's such a powerful summary. And actually, on the note that you mentioned with the United Kingdom, Dr. Morell, could you speak a little bit about the fact that other countries like the UK have recently rescinded sex change treatments on minors, even saying that there's not enough evidence to support the safety of our clinical effectiveness? Why are we not seeing that happen in the US?
Yeah, thanks for asking that, Brittany. Yeah, so the UK did a 4-year study, spent, I'm guessing, several million pounds, did 6 or 8, depending on how you count it, systematic reviews, which is the highest level of evidence. And after all of that, something which really hasn't been done in America, they found that there really wasn't any proof that this helped kids doing this or that it was safe. And I want to reiterate that they also found that the whole idea about 50% of these kids committing suicide, thank God, is just not the case. The risk is something more like 0.01 per year, which is, I wish it was 0. I wish it was 5 times lower than that. But at least we know that these parents and clinicians shouldn't have a gun to their head and doing risky things to try to prevent from, 50% risk of suicide. So it was very important the UK did that study. They already weren't doing surgeries on kids. They banned puberty blockers. They banned hormones until 16. Cass says really shouldn't be used till 18 without extreme caution. And other countries, Norway, Sweden, Finland, they're kind of going this other direction too. And in America, the American Society of Plastic Surgery, which is a very prestigious organization, they've said we don't think that there's evidence for this in kids. So it's starting to creep into America. There's other organizations that haven't spoken, so maybe in the next year they'll be speaking and saying this is wrong. But still, yes, you're right. The AMA, the American Academy of Pediatrics, American Medical Association of Medical Colleges, they're still just doubling, tripling down on this. And why is that? That's what everybody wants to know. It's hard for me to express how, again, all the doctors didn't sit in a room, look at the evidence and start this. And so now that the evidence is different, we need to vote again. What happened is there never was evidence. You had a couple doctors in powerful organizations that started it. And now right now in medicine, kind of fitting in and going along, the word of solidarity gets you a lot further than like coming up with evidence, I hate to say. And I think that there's some extra political power that doctors have when they kind of go along with some of these things. There's money. Michelle Haverla talked about how we're made $120 million just with the patients that she found. And there's also kind of professional. It's hard to explain if you're not a surgeon, but you just want to do the cool new thing because you can. Just like Elon Musk wants to go to Mars because he can, or some tech bro wants to build an app because she can. It's just something you want to do. You want to be on the cutting edge. You want to be at the center of excellence. You want to do the crazy hard thing. I understand that impulse, but we need to be checked right now by evidence. And I think, unfortunately, one of the big things that's going to influence us in America is people like Chloe Cole, other detransitioners that are suing their doctor. I hate to say this, suing the American Academy of Pediatrics, and also the bans that have been passed in 24, 25 states, thanks to Do No Harm and other groups. I'm afraid that a lot of us are kind of covering our eyes at all this evidence that's changing minds in the UK.
Great, thank you. And we're going to move to questions in just a minute here. But Michelle, I wanted to ask you, we're starting to see already that some doctors who are speaking out and trying to blow the whistle are already coming under persecution, actually by the federal government. One young doctor, Ethan Heim, was literally indicted by the Department of Justice just for blowing the whistle on Texas Children's because they have been performing these procedures, even though they said they were going to stop. What can be done to protect physicians and healthcare professionals who are trying to protect our kids from these irreversible surgeries.
Absolutely. And Dr. Heim is really a hero for what he's exposed at Texas children, and a big part of the legislation that has passed in Texas so far. Really the first part is exposure of the problem, which is what we've done to AIM here at Do No Harm, what January and Dr. Morella are doing, and what we've done with this database. And for those that claim that these procedures are not being done on children, our database refutes that claim. And we are holding these institutions accountable for what they're doing to children. We're also opening up debate about the dangers of so-called gender-affirming care, which we hope will provide a place for healthcare providers who oppose this ideology to speak openly and find a community to help fight back against these dangerous practices, because there really is strength in numbers. And one interesting theme we found as we researched children's hospitals for the database is that there is typically a very vocal physician or clinician, such as a psychologist or a social worker, who's really pushing this ideology on the wider institution. And they're a very loud minority. But if there are enough people to speak out, hopefully we could really push back and see this practice be completely reversed. The other piece is pushing legislation to protect children from these practices, which would really help healthcare providers who don't want to provide this supposed gender-affirming care. And we've had, I believe, about 28 states so far who've passed laws with age limits on gender-affirming care. And we hope that healthcare providers and legislators will use our database as a tool to move more legislation in the country to protect children.
Thank you so much, Michelle. January, I want to end with you before we open it up for questions. And I see in some of the questions that this is actually a common question, which is, what can we do? We know that our AMAC members, they like being involved. We want to make a difference in our communities. And also, as we've already heard tonight, this is affecting our community of AMAC members. They're already feeling it personally. So could you give us a little bit of advice about what someone can do, first of all, if they know someone, a young person struggling with this, and also, even if they don't, what they can do to help in this fight to protect our kids?
Such an important question. And Dr. Morell touched on this earlier. We know that if you give these kids time, you set healthy boundaries, you allow them to go through natural puberty, the vast majority of them will desist in their distress. And that's exactly what happened with my daughter. Now, our situation was exacerbated by what the school did. So it took a very long time to repair that trust. And we're still healing from the trauma of everything that we've gone through. But the younger the child, the better the outcome. It's always better when both parents are on the same page, because unfortunately, we have situations where parents are losing custody to parents who, quote unquote, affirm this false identity versus those who are trying to protect their child from medical harm. We have cases where CPS is being called in California, Oregon, Washington. So we're at a critical tipping point. And my call to action for the grandparents on this call would be to inoculate your grandchildren from this ideology. Teach them the truth at early ages that we can and should have compassion for those who are struggling with identity issues, but we should not be affirming any kind of false identities that can lead to medical harm. Now, for those who actually have loved ones who are struggling with these kind of identity issues, I always lead with compassion and love. And if you come at this issue from a place of genuine concern over the long-term mental and physical health outcomes of these interventions, oftentimes you're going to kind of tear down the wall of defensiveness, because it's not about rejection. It's really about, fundamentally, is this going to fix your distress? And will you suffer negative consequences from these medical interventions? We have put together an amazing parent resource page at donoharmmedicine.org under resources. And so, these are a longer conversations, but if there are any parents or grandparents out there, they can reach out to me through the Do No Harm website, and I'm happy to set up a Zoom meeting with them and connect them to specific resources for their whatever situation they have with their child or grandchild.
Thank you so much, January and Michelle and Dr. Morell, for all of your expertise and also for your care and compassion on wanting to help so many people. I know it's making a big difference in the lives of many people. And we have a good number of questions from our members here. So I'll start with the first one, which is a tough one. This is from someone who said, we just learned our niece is allowing her 12-year-old son to identify as a female and go by a female name. We don't agree with this, especially at his age, but they are totally supportive of his desire to change. How do we speak into this? And I will leave it up to the panelists to decide, feel free to jump in based on whoever you think might be, whoever wants to answer the question.
I'll let January jump in or Michelle if they'd like, but I would just say in general in medicine, in any other field, anorexia, delusions, whatever, the one thing you do is you never encourage the delusion. So you're not going to, and I'm sorry if you find that term disrespectful, but that's just a general principle. So I wouldn't go along with the pronouns or go along with, forgetting memories. These poor parents, that even the ones that support them, they say, don't talk about those memories, cut up the pictures of when I was a 6-year-old girl or 8-year-old girl or whatever. You shouldn't go along with all of that stuff. That being said, you do want to maintain a relationship if you can. So you want to, like January is saying, you should be compassionate, you should be supportive, you should be there for them, you should love them no matter what. You do want to maintain that relationship. And I hate to say it, things will not always work out, or they may take several years to work out. But if you're close and you're supportive and they know that you love them, you're going to have a much better chance of working things out. And because they'll know that you're going to be there for them.
Yeah, I agree with Dr. Morell. And, unfortunately, I speak to grandparents a lot who are in this situation. And so I would start by asking questions. How much do you know about this? Where did you get the information? How many doctors have you spoken to? And it also really varies wildly by which state they're in. So if you're in a state like Colorado, where Dr. Morell is, or California, or Washington, Oregon, chances are that parent has been lied to. And the bottom line is parents are not being told the full truth. They're not being told that if you don't socially or medically transition your child, that chances are that they will resolve their distress. Instead, oftentimes, parents are told falsely that if you don't medically transition your child, they are most likely going to commit suicide. And so parents have been emotionally blackmailed into believing not only is this evidence-based care, but their only alternative is their child's impending suicide. And so we are in a situation where we have to get better information out to these parents so that they know what treatment options they truly have. But just like Dr. Morell said, you want to keep that open communication. And I would always tell grandparents, buy time. If they're pushing you to quickly affirm your grandchild in these identities, just say, we're going to do the best we can. What we can tell you is we love you absolutely unconditionally. We love our grandchild unconditionally, but we may need some time to further understand this. And then you can start to see if your adult child is open to looking at other types of research, like the CAS review, like the WPATH files, and just letting them know ahead of time, I am only coming at this from a place of concern from where this pathway may take my grandchild.
Thank you, January. And part of your answer answered another question that someone was asking about, do doctors tell children the information about how these puberty blockers will affect them? And I think the answer is a lot of times, no. Unfortunately, they're not being honest and upfront about the potential side effects. But we had another question as well, as far as if one wishes to question a local school district about their involvement in the gender transition issue, do you have questions available or other resources to help us get directly to the point?
Yes, I had actually, at the beginning of the school year, a lot of people may not be on Twitter or X, but I had put out a list of questions, because you can't just go in there and ask, are you teaching gender ideology? Because unfortunately, they've kind of caught on to those buzzwords. And so sometimes you need to go in there and have direct conversations with the school administration, the school counselor, and even the child's teacher, and ask them, if a child comes to you and says that they are a gender other than what they were born, what is your protocol? What is your policy? Do you teach lessons on gender identity? Do you have any books on gender identity? May I see them? And so the other part of inoculating your grandchildren and children from this is teaching them very clear rules about what is acceptable to talk about with teachers and other adults and what isn't. And so there's an organization called Courage is a Habit that has a great tool called Stranger Danger. And so they teach the children, and you actually should be practicing this at home. If a teacher brings up pronouns or gender to you, you tell them, stop. I don't feel comfortable having this conversation and I need to call my mom. Those grandchildren need to know those are not safe conversations to have outside the house. That is really where we are right now. And parents need to use the tools and resources available to them in order to protect their children from this ideology.
Thank you, January. Another question is, how are doctors, nurses, and healthcare professionals educated on whistleblower protections?
Yeah, I don't think that's done at all. Not at all.
And my guess is that at Do No Harm, you are helping medical professionals know about some of those protections.
So at specifically at Do No Harm, if a medical if a clinician wants to bring something to our awareness, they can do so. And we're happy to provide the donoharmmedicine.org. There's a tip line there. So you can do so anonymously if you're concerned about exposure. And believe me, I know many of us are all aware of that. I've experienced that myself in clinical practice. But in terms of whistleblower itself, that's not something that I've ever experienced or encountered in practice. And I know that there are laws, but I can't speak to them, at least intelligently here. So.
That's great. Thank you, Michelle. And I know there are a lot of great legal groups out there that focus on the legal protections that healthcare providers have. Another question is, how could someone find detransitioning help?
I mean, honestly, we're in a tough position right now, like January said. The basically mainstream medicine, and please, January, Michelle, interrupt me if you have a good resource to go to. But unfortunately, detransitioners are kind of like a lost generation or lost patient population, and we don't have good resources for them. So to be honest, I bet a lot of what is happening is you try to connect with other detransitioners and see what they've learned and see if you can find other doctors underground or whatever that know what they're doing. That's probably what's really going on. And I'm sure if you talk to me or January on Twitter or something, we would connect you with, somebody like that. But
Absolutely. And we're at the infancy of putting these types of resources together. For therapists, we have Therapy First, which are therapists willing to do exploratory therapy with these adolescents and adults, because that is the treatment of choice to treat this issue. And so now we're trying to start putting together a list of doctors very similar to that will help these detransitioners detransition, come up with a protocol. There are some things in the works. There's also a detransitioner by the name of Camille Kiefel, who's put together Detrans Help. So there have been a couple of projects. Unfortunately, some of them have not had a lot of life to them. And so we're just still at a time where there's not a lot of organized help. But just like Dr. Morrell said, if you contact us through Do No Harm or even through X, we can absolutely help them and put them in touch with other detransitioners. I think that has been the biggest help to the detransitioners, is finding community with one another and really just coming together as a community that way. That I've seen a lot of healing come through when they meet each other.
Thank you, January. And our final question, are there alternative healthcare providers that do not promote this ideology?
I want to be clear, and January, you can interrupt me, but most doctors don't buy this. I ran a policy in Colorado, which is a blue state, and 62% of doctors, in fact, it was 65% before there was some pushback, said this is child mutilation, is what what we called it, which is like a federal felony crime. So most doctors don't agree with this. The problem is in your pediatric department or your children's hospital or at an academic center, you're going to have a high concentration of this. I know doctors where there'll be 2 out of 36 that want to do this to kids, but the others are quiet because they're afraid of getting in trouble. So the real answer is you need to probably meet your pediatrician or whoever before your kid does, and you need to ask some questions. But if that's hopefully helpful.
Wonderful.
Yeah, and there is an alternative to AAP, which is the American College of Pediatricians, and they have a wonderful website called Biological Integrity. And I'm sure you can find a pediatrician through those networks as well that would not buy into this ideology.
Thank you, January. And by the way, on the whistleblower question, we had one of our members, Robert, tell us that there's another resource called Empower, and that's actually spelled EMPOWR, so without the E.US, that can help whistleblowers. So that's a resource from a fellow member, a recommendation. And we're now right up at the hour. And I want to thank all of you for participating, for giving us such a very real understanding of what's happening in this current struggle with our children, who we want to keep innocent and who we want to protect so that they can live thriving lives and so that they have the most ability to make decisions for the rest of their lives that are going to help them thrive. So thank you so much, January and Michelle and Dr. Morell. And I want to just ask, not to put her on the spot, but if it's okay, I'd like to ask Beth just to come on for a hot second and say hello and introduce herself. Beth also works at Do No Harm, and she is incredible. And she connected us with these amazing panelists and helped make this possible. So Beth, before we sign off, would you be available just to say hello? You might be muted.
I'm muted. I'm sorry. It's a little dark in my background right now, but hello. Thank you all so much for being here tonight, and thank you to Mary and Travis, and of course Brittany, for putting on this great webinar. It's wonderful.
Thank you so much, Beth. We're really honored to be able to learn from you all and partner with you on this. And we're also extremely grateful to all of our members who joined tonight and who want to help your family members and also help our country more generally with this. So please feel free to reach out to us with any questions. And we will look forward to hearing from you all soon and also hosting similar events in the future. So thank you all and have a great night. God bless you all.